So, in order to understand me as a person and what drives me to do medicine, I feel it's important to do a little history telling. So, for me, the story starts as a little girl. Now, I believe if I go back to around age 9, that's when I decided I had interest in medicine. Now, I had no idea what that meant, okay? My mom was a nurse, and for me, I just remember sky was the limit. Like, my mom's a nurse, I'm gonna be a doctor, okay? I didn't have a physician in my family who I could say, hey, what does this entail? You know, so fast forward to medical school, after working hard throughout undergrad, I get to medical school and I actually am a new mom. I have a 5-month-old. And I happenstance to learn about emergency medicine because I feel at the time, emergency medicine wasn't the traditional, cardiology, internal medicine, surgery, peds. And interestingly enough, my medical school didn't even have a dedicated emergency medicine rotation. So I do a primary care rotation when I'm a student, and 2 weeks of it is spent in the emergency room. And every specialty, I'm sure at one point I wanted to be an OB-GYN, pediatrician. My mom tells me, I think when she was alive, she'd say, I didn't you say you want to be a cardiologist? I can't remember. But I go there for 2 weeks and it's amazing. And for some reason, it was like, how could you love it? It's chaos. This place is just all over the place. But for me, it was intriguing of how I can make this organized chaos out of chaos, right? So I go on to do emergency medicine. What was even more important as a mom, I knew that work-life balance was important. I wanted to be a good mom. I wanted to be there for my child. At the time when I started medical school, my oldest son, he was 5 months old. So that was the story of how I came into emergency medicine and how do I continue to have that drive, right? ER is actually one of the highest specialties with burnout. So for me, the younger doctor that I was many years ago, I'm entering my 10th year of practicing as an attending physician, has completely changed. So things that I would have done as a younger doctor, I'm still doing, but I've evolved. Now, let me just give you an example. So I feel that as a medical student, when you're learning how to care for patients, you learn how to be a good doctor as a clinician. But I feel that I've learned how to be a greater doctor through being who I am as a person and having that ability to connect with patients. So of late, I think within the past month or two, I had a patient where it was a mom and daughter, and the daughter was very attentive to her mom. The mother had been recently diagnosed with cancer, had gone all through all these surgeries, and she hadn't been feeling well. She was like living with her, taking care of her. She was her caregiver. Um, and basically, she came in to be diagnosed. So she ended up having a significant pleural effusion. So she had fluid in her lungs, and she needed to be admitted to see if they could drain that fluid. And the daughter had all these questions. And some of the questions I could answer, and I had to explain to her as an emergency physician, we're here to provide stabilizing treatment, but I may not have all the answers. But there was something different. When I looked into her eyes, I saw myself. Now, how does that, what do I mean by that? So my mom, she recently passed a year ago, and she battled cancer for 3 years. So I became the physician liaison slash caregiver slash daughter physician. And I remember being exactly on the opposite side where I would go to the appointments and I took off my doctor hat and I was the daughter and I was like hanging on every word. And I could tell from all the questions that she knew I may not have the answer to, that she was just looking for answers. So I gave her all the answers I could. And at the end, I gave her a little spiel and I said, I know exactly what you're going through. I had a mom who battled cancer for some time and she recently passed. And I remember wanting to have answers for every single question at every single moment. And I said, it's not always going to make sense every day. And you're just going to have to take it one day at a time. And then her tears literally started flowing. And I did something what I would say unorthodox, because they don't teach you this in medical school. And I literally, when those tears started flowing, I could see myself on the other side. I gave her a hug. Now that was priceless. I could tell from her look that, the care I'd given wasn't just about diagnosing her mom with fluid in her lungs, that I had taken that extra time to connect with her. And you could just tell through her eyes how it meant the world. Now, how you say that happens in emergency medicine, you have to rush and see patients, but I managed to do that. I may not do it with every single encounter, but that priceless moment allows me to have passion in emergency medicine.